Disclaimer: I do not own the rights to the images or information provided. This was purely made for the purpose of studying for boards. Chapter 3: Malformation. Malformations. Brain malformations. Hydrocephalus. Many circumstances could cause enlargement of the ventricular system. It is usually most evident in the lateral ventricles, and the most common cause is an interference with the flow of CSF from the ventricles into the subarachnoid space, which results in increased CSF pressure. This hypertensive hydrocephalus causes extensive degeneration of the telencephalon, especially the neopallium. The subject of hydrocephalus is considered in the discussion of CSF in Chapter 4. Hypoplasia of the prosencephalon, cerebral, telencephalic, aplasia, and encephaly. Calves have been observed to be born with failure of the telencephalic vesicles to develop. This is associated with a small opening in the calvaria on the midline at the level of the orbits where fluid, presumably CSF, emerges. Figure 3-21. The calvarial defect here is called a cranioschisis or cranium bifidum. The skin around this opening is continuous with a malformed diencephalon inside the small cranial cavity. No cerebral hemispheres are present. The brainstem and the cerebellum are present but reduced in size and abnormally shaped. No recognizable thalamic geniculate nuclei or mesencephalic colliculi exist. Figures 3-22 and 3-23. The eyes are well developed, and all cranial nerves except the first, the olfactory neurons, are present. In human newborns, this is called anencephaly, which is an incorrect term because it implies complete absence of brain development. No single term best describes this malformation. Telencephalic, cerebral, aplasia accounts for the most extensive part of the malformation. One hypothesis about the mechanism involved in this brain malformation is as follows. If some factor causes the new rectoderm of the prosencephalon to fail to separate from the skin ectoderm at the level of the rostral neuropore, which could prevent the outgrowth of the telencephalic vesicles and could create a defect in the closure of the calvaria, resulting in cerebral aplasia and cranioschisis, respectively. CSF could leak from the third ventricle of the diencephalon, which could remain attached to the surface skin. The cause of this malformation in animals is unknown but is one of the neural tube defects thought to result from a deficiency in folic acid in the diet of the human mother very early in development. Even Figure 3.23 lateral view of the brain of a calf with prosencephalic hypoplasia. Note the abnormally shaped brainstem and cerebellum before pregnancy may be detected. Hyperthermia has also been implicated as a cause of this neural tube defect. Affected calves are usually unable to get up at birth. Video 3-1 shows a newborn Guernsey calf with this malformation. When supported, these calves struggle to stand and exhibit considerable voluntary movement. They are blind because of the lack of any cerebral visual cortex for perception, but the cranial nerves function normally. Spinal reflexes are intact, and surprisingly, some evidence of nociception, the perception of noxious stimuli, exists, which supports the idea that some conscious perception may occur at the level of the diencephalon. The evidence for this is the occasional voluntary struggling that occurs when forceps pressure is applied to the digits as a noxious stimulus or when forceps are pressed against the nasal septum, and occasionally a loud noise elicits a voluntary response. We have not observed this malformation in other species of domestic animals. Meningocele, meningoencephalus. A newborn animal with a large skin-covered, soft swelling outside the calvaria, usually on the midline, has a meningocele or meningoencephalocele. The latter has brain tissue in the swelling along with the meninges and is, by far, the most common of these two malformations, but microscopic examination of the wall of the swelling is commonly required to appreciate the brain component. Figures 3.24 and 3-25. The calvarial defect is called cranioschisis or cranium bifidum. This is usually on the midline and at any level along the length of the calvaria. This cranioschisis may be very large, with both cerebral hemispheres bulging into the meningoencephalocele, or it may be small and involve an extension from the brainstem into the meningoencephalocele. In a large meningoencephalocele, the protruding cerebral hemispheres are usually very thin and fluid-filled because of dilation of their lateral ventricles, which results in the meningoencephalocele being soft and fluctuant. Usually, the cause is unknown. It is seen in all species of domestic animal but may be more common in pigs. In one kitten, a meningoencephalocele was associated with the mother being treated orally with griseofulvin throughout the gestation period for a ringworm infection. Figure 3-26.27. A very large meningoencephalocele occurs as part of an inherited craniofacial malformation in Burmese cats. Figure 3-27.33. Prior to its recognition as an inherited disorder, This malformation was quite common in this breed in many different locations in the United States. It became apparent when a number of breeders attempted to breed Burmese cats with shortened faces. In addition to the large meningrown cephaloceles that often hung over their shortened faces, these kittens had significant facial malformations. The superior jaws and nasal areas were shortened and had no recognizable nares, planum nasale, or nasal cavities. Olfactory bulbs or peduncles were absent in the malformed cerebrum. A philtrum was present on either side of the rostral midline of the face and vibrissae on both sides of the cleft. Figure 3-28. Duplication was also evident in the 2 pairs of maxillary bones and 2 sets of maxillary canine teeth. No gross evidence of any eyes was seen, but 1 pair of orbits was present. No optic nerves or chiasm was associated with the diencephalon. The mandibles were prominent, and the tongue was enlarged and protruded from the mouth. These facial deformities are the result of abnormal cranial-neural crest development. This is a prime example of what could happen when breeders select for a characteristic that, in reality, is a malformation, that is, the shortened face. It is clear that more serious and life-threatening malformations may result. Selection for a longer cat skull shape will eliminate the problem. The malformation that occurs in Manx cats that are bred for the absence of a tail is a similar error in judgment by misinformed breeders. This is described in the section on spinal cord malformations in this chapter. Exencephaly is now defined as brain tissue that protrudes out of the cranial cavity and is not covered by skin. Figure 3-29. Stratified squamous epithelium over the brain is absent, and only connective tissue of the meninges exists. This may be determined only by microscopic study of the protruding tissue. When these malformations are studied microscopically, it is found that exencephaly is much less common than meningoceles or meningrown cephaloceles. Both malformations require a cranioschisis, which is the opening in the calvaria where the bones have not fused. Lipomeningocele. A lipomeningocele, as the term suggests, is a meningocele that has a large amount of fat associated with it. It may occur along the midline of the calvaria or the vertebral column through a cranioschisis or spina bifida, respectively. It consists of fat-filled meningeal tissue covered by skin that is continuous with the falx cerebri in the head and the dura of the spinal cord and the vertebral column. Figure 3-30. With no associated neural tube malformation, no neurologic signs are present in these animals. These are rare malformations, and the cause is unknown. Duplication of the prosencephalon. Prosencephalic duplication occurs most commonly in calves and is associated with varying degrees of duplication in the face, called diprosopis or dicephalus. Figure 3-31. The diprosopis includes 2 separate nasal regions with 4 nares and nasal cavities, portions of 2 superior and inferior jaws, and usually 3 orbits. The 2 complete orbits on the lateral sides of the head are normal. The central orbit is enlarged to accommodate 2 separate or fused eyeballs. The region of the cranium is broad, but 2 normal ears, 1 foramen magnum, and 1 normal atlanto-occipital joint are present. In the widened cranial cavity, 4 cerebral hemispheres exist. Figure 3-32. 1 hemisphere exists for each nares, formed from the embryonic olfactory plateau that gave rise to the olfactory nerves. Each cerebral hemisphere has a normal olfactory bulb that resides in the cribriform plate of each of the 2 separate ethmoid bones. Each of the 2 diencephalons is associated with a pair of eyes, a pair of optic nerves, and an optic chiasm. Figure 3-33. The brain stem usually becomes single somewhere in the mesencephalon. The pons, medulla, and cerebellum are all single structures. This is a partial dicephalus. These calves are usually born alive but are recumbent and unable to stand. Holoprosencephaly. Holoprosencephaly occurs with the cyclopean malformation. This is common in lambs when their dams are exposed through their diets to Veratrum californicum on their 14th or 15th day of pregnancy. This plant contains the alkaloid cyclopamine, which interferes with the sonic hedgehog signaling in the precordial plate. 13. This results in a failure of the visual area on the ventral aspect of the prosencephalon to divide into 2 fields. 1 midline optic vesicle develops, producing a single eye. The interference with neural crest development results in the absence of any nasal portion of the respiratory system and olfactory system and the presence of a proboscis dorsal to the eye. Figure 3-34. The interference with prosencephalic development results in only a single midline telencephalic vesicle, holoprosencephaly, that grows caudally over the brain stem. Varying degrees of a longitudinal cerebral fissure develop caudally in the individual cerebrum. This gives rise to 3 forms of holoprosencephaly. 1. Alobar, 2. Hemilobar, and 3. Lobar. In all 3 forms, the corpus callosum fails to develop. Ahinencephaly is another term for this cerebral malformation because development of the olfactory system fails to occur. These lambs may be born alive, and some survive for months. We have seen a semilabor holoprosencephaly as an isolated malformation with no ocular or facial abnormality in a 6-month-old Morgan horse with the clinical complaint of abnormal behavior and occasional seizures. Figure 3-35.15. The cerebrum was partly divided caudally and had no olfactory system structures. The ethmoid bone had no cribriform plates. We have seen the cyclopean malformation on rare occasions in puppies, pigs, and kittens. Figure 3-36. In one case, a dam treated throughout pregnancy with griseofulvin had a kitten with this malformation. Figure 3-37.27. Hydranencephaly. Hydranencephaly is a model for a virus-induced cerebral malformation in animals. By definition, hydranencephaly is the cerebral abnormality in which the neopallium is reduced to a thin, nearly transparent pyoglial membrane with no associated parenchyma other than a thin layer of ependyma, lining the expanded lateral ventricle. The latter represents compensatory hydrocephalus because the increase in CSF volume and ventricular size is secondary to the absence of cerebral parenchyma. The loss of neopolyal parenchyma represents both aplasia resulting from the viral destruction of germinal layer cells and atrophy resulting from the viral destruction of already differentiated neopolyal neurons. Some of the destructive lesions may represent the effect of the viral agent on the developing vasculature and loss of adequate blood supply to the neopallium. Usually, the olfactory polyopallium, the archipallium, hippocampus, and the basal nuclei are spared. The brainstem and cerebellum are also spared, but in some cases, cerebellar lesions are present. The degree of lesion is dependent on the viral agent and the period during gestation when the infection occurs. Usually, no changes occur in the skull bones, and the cranial cavity is normal in size and shape. Bluetongue virus has been reported to produce this lesion in cattle and sheep in both clinical and experimental studies. 19-22 in sheep. This virus causes systemic disease that is characterized by fever, lameness, and erosions and ulcerations of the oral and nasal mucosae. The live virus vaccine that was produced to establish immunity in sheep was found to cause brain malformations in lambs born to AWIS immunized during pregnancy. These lambs were referred to as dummy lambs because of their depressed sensorium and lack of response to their environments. They were also blind. Experimental studies of direct inoculation of this vaccine into fetal sheep demonstrated that inoculation between 50 and 58 days of pregnancy consistently produced in the fetus a severe necrotizing encephalitis that presented at term as hydranencephaly. Inoculation between 75 and 78 days of pregnancy caused a less severe multifocal encephalitis that presented at term as poencephaly. These are congenital cystic cavities in the cerebrum that commonly communicate with the lateral ventricle. Inoculation after 100 days of pregnancy caused a mild encephalitis in the fetus, with no resulting malformation. Thus, the nature of the lesions at term depended on the gestational age at which infection of the fetus occurred. In lambs, the germinal cells of the telencephalon are especially susceptible to this infection and are most abundant at the end of the first trimester in the fetus. Necrosis of the germinal cells in the first trimester prevents them from contributing to the formation of the neopallium and, along with the necrosis of the initial neopolyal cortical plate that is formed at that time, leads to the lesion referred to as hydranencephaly in lambs. At birth, the inflammation has resolved, leaving the remaining neopolyal membrane, which represents the scar resulting from in utero infection. The lesion associated with this bluetongue virus infection represents a combination of abnormal development, hypoplasia, aplasia, and destruction, necrosis, of differentiated tissue, resulting in atrophy. A similar situation occurs primarily in the cerebellum as the result of a bovine viral diarrhea virus infection in cattle and panleukopenia virus infection in cats. See Chapter 13. Hydranencephaly occurs in calves that are exposed in utero to the same bluetongue virus. Figure 3-38.22 as in the case of newborn lambs. These calves are born lethargic, blind, and unable to suckle normally. The dams of these calves have no clinical illness, but their serum contains antibodies against bluetongue virus, and the presence of these same serum antibodies in the affected calves prior to the ingestion of colostrum indicates in utero exposure to this virus. Hydranencephaly occurs in these calves when the infection occurs around 125 days of their in utero development. The bovine viral diarrhea virus has been reported to cause hydranencephaly, but it has not been seen in the cattle in the northeastern United States. Cache Valley virus is another cause of hydranencephaly in ruminants in the United States. In Australia, Japan, and Israel, hydranencephaly has been observed in ruminants in association with in utero infection with acabane virus in the first trimester. Figure 3-39.10. 11. The same in utero viral infection has been associated with calves born with arthrogryposis. These calves have lesions in their spinal cords and loss of ventral gray column neurons. The denervation atrophy in muscles causes the arthrogryposis. In experimental studies in cattle, exposure to this virus between 74 and 104 days of gestation results in calves that have hydranencephaly. With exposure between 104 and 173 days, calves are born with arthrogryposis, and with exposure between 173 days and term, the calves have meningoencephalitis. Other viruses that are foreign to the United States and have been implicated in causing hydranencephaly in newborn ruminants include ano and Chusen viruses. Hydranencephaly was observed in a 3-month-old kitten of the domestic short-hair breed that had been blind and ataxic since birth. 8. Feline panleukopenia virus was implicated on the basis of direct immunofluorescence of the virus in tissues. As a rule, the cerebellum is more severely affected by this virus, and feudinal lesions are present in the cerebrum. We have observed bilateral hydranencephaly in related Labrador Retriever litters. At necropsy, the cause appeared to be compromise of blood flow in the cerebral arteries. CT and MR images were diagnostic. 1. Unilateral hydranencephaly was found in an 8-month-old miniature doodle, in which the only clinical sign was a contralateral visual deficit and sporadic seizures. Figures 3-40 through 3-43. The primary lesion was limited to the portion of the right neopallium that was in the distribution of the right middle cerebral artery. The transparency of the remaining intact cerebral membrane allowed the observer to see the hippocampus on the floor of the lateral ventricle. The presence of polymicrogyria in the left cerebrum supported an in utero interference with the blood supply of the neopallium that was much worse on the right side. The cause of this vascular compromise was not established, and in dogs, in utero viral infection that causes congenital cerebral brain lesions has not been recognized. The early development of these lesions in this dog was supported by the secondary hypoplasia of the right side of the diencephalon and the much reduced size of the right cerebral projection pathways, that is, the crus cerebri, the longitudinal fibers of the pons, and the pyramid. Similar lesions have been produced experimentally in puppies by prenatal occlusion of the internal carotid artery. In humans, the pathogenesis of hydranencephaly includes infections, teratogens, genetic defects in cerebral vasculature, and genetic defects in neuronal migration. Sporadic cases of hydranencephaly are recognized in MR images of clinical patients. Figures 3-44, 3-45, and 3-46 are MR images from a 2-year-old castrated male wire hair pointer and a Labrador Retriever with a 1-year history of unusual focal seizures. These images show unilateral hydranencephaly associated with hypoplasia of the ipsilateral diencephalon and pyramid. Lissencephaly. The term lissencephaly means a smooth brain without evidence of cerebrocortical folding to produce gyri and sulci. It is a congenital condition seen most commonly in the Lhasa Apso breed of dogs. Figures 3-47 and 3-48.7, 26, 32. The cerebral cortex is thickened, pachygyria, because of the abnormal distribution of neuronal cell bodies. The malformation presumably results from impaired neuronal migration, and an inherited genetic abnormality is presumed in this breed. In humans, intrauterine hypoxia or perfusion failure have also been suggested as possible causes of lissencephaly. Clinical signs seen in dogs with this malformation include difficulty in learning routine training programs, abnormal behavior, and occasionally slow postural reactions and poor menace responses. Generalized seizures may occur when the dogs are 10 to 12 months old. We have seen lissencephaly in 2 related litters of Corrit cats that exhibited abnormal behavior shortly after birth. This diagnosis can be made with MRI. 26. Lissencephaly combined with a cerebellar hypoplasia and dysplasia occurs in children because of an autosomal recessive inheritance of a mutation in the gene known as the RELN gene. This gene normally encodes for RELN, which is a protein associated with neuronal migration. 12. We have observed this same combination of dysplasias in a litter of wire fox terriers, figures 3-49 and 3-50, and a litter of Irish setters. These dogs exhibited a severe non-progressive cerebellar quality ataxia from the time they began to walk. One wire fox terrier was provided with a cart to help with its ambulation and lived to be 4 years old. At 1 year of age, this dog developed episodic generalized seizures that were presumed to be caused by the lissencephalic dysplasia. MRI confirmed this same diagnosis in a 4-year-old Samoyed. The cerebellar lesion similar to the cerebral lesion could be explained by an aberrant process of neuronal migration. Neuronal migration is a complex process involving astroglia and many extracellular factors, one of which is brain-derived neurotrophic factor. This factor has been shown to provide directional cues for the migration of the external germinal layer to the granule neuron layer of the cerebellum. Cerebellar malformations. Congenital cerebellar abnormalities include genetic disorders resulting in various forms of hypoplasia and dysplasia and in utero viral infections causing hypoplasia and atrophy. These are described in Chapter 13, which discusses the cerebellum in detail. Complex malformation of calves. A unique multifocal bone and neural tube malformation has been described in calves as Arnold-Chiari malformation, presumably because of an assumed similarity to a human malformation that has been given this eponym. 2. Although some similarities exist, the distinct differences in the bovine disorder make the use of this eponym incorrect. These calves are usually born alert and with vision but are recumbent and unable to coordinate their neck, trunk, and limb functions to be able to stand. They often exhibit opisthotonus and abnormal nystagmus. A sacrocaudal spina bifida is present, with a meningeomelisal, a malformed tail, and an associated loss of tone and reflexes in the anus and tail. At necropsy, the meningomyelocele is seen to consist of sacrocaudal nerves connecting from their spinal cord segments in the exposed vertebral canal into the skin-covered swelling over the spina bifida, figures 3-51 and 3-52. The ganglia of these spinal nerves are located in the skin. Myelodysplasia is present in the sacrocaudal segments. In the brain, the cerebellum is flattened and elongated into a cone-shaped structure, and it is displaced caudally along with the caudal brainstem into the foramen of the atlas and axis. The associated cranial nerves are elongated to extend back into the cranial cavity to exit through their respective foramina. In addition, there is a bilateral abnormal extension of the occipital lobes into the caudal cranial fossa that was vacated by the cerebellum. These abnormal extensions of the occipital lobes pass ventral to the tentorium, which results in a groove on the lateral side of each of these extensions. These are not herniations of the normal occipital lobes, figures 3-53 and 3-54. This malformation has been observed in calves since the early 1900s and is assumed to be an inherited defect. Occipital bone, Chiari-like, malformation and syringohydromelia. A dilation of the central canal is hydromelia. A cavitation of the spinal cord parenchyma is syringomyelia. They often occur secondary to a herniation of the quadventral cerebellar vermis into the foramen magnum in toy dogs and other small breed dogs. The cause of the herniation is presumed to be a caudal cranial fossa that is too small for the volume of brain tissue that it contains. 5, 6, 23-25. Some veterinarians refer to this as an Arnold-Chiari type 1 malformation, a human disorder that involves herniation of the cerebellar tonsils, which are not present in animals. Although the pathogenesis may be similar, we believe this eponym is inappropriate for the canine disorder, as the dynamics of this region are significantly different between biped and quadruped animals. More recently, the term Chiari-like malformation has been adopted for this abnormality. The primary skull defect that compromises the size of the cranial cavity may well be a product of selective breeding for the small size of these dogs. Until we better understand the skull malformation that leads to the presumptive small caudal cranial fossa, occipital bone malformation will be considered the primary defect in these dogs. Usually, both hydromyelia and syringomyelia are present, and at some point, a communication exists between these two fluid-filled spaces. Therefore, we refer to this spinal cord lesion as a syringohydromelia. Syringohydromelia occurs most commonly in the cervical spinal cord segments as a multifocal or continuous lesion, but it is often present in the thoracolumbar segments as well. It is thought to result from the compromise of CSF flow at the foramen magnum caused by cerebellar herniation and the compression of the underlying medulla. The cranial cavity is a closed space, and the movement of CSF is greatly influenced by the pulsation of arteries associated with the heartbeat and the venous outflow at the foramen magnum. CSF pulsates in synchrony with the heartbeat and flows in both directions at the foramen magnum, but primarily from the cranial cavity to the spinal cord subarachnoid space. When this normal pulsating flow is obstructed by cerebellar herniation, the smooth flow of CSF is converted into a higher pressure pulsatile flow, and turbulence occurs in the spinal cord subarachnoid space, forcing CSF, vascular fluid, or both into the parenchyma along the penetrating peривascular spaces. The area of least resistance in the spinal cord parenchyma is in the dorsal funiculi, where the syrinx is most commonly found. The pathogenesis of this spinal cord lesion in humans as well as in animals is very complex and still under intense investigation. 9. New concepts of the pathophysiology of the development of syringohydromelia is based on research that showed a higher pressure of CSF in the spinal cord cavities than in the subarachnoid space. 25. In addition, it was determined that these cavities contained extracellular fluid and not just CSF. The driving force is still the intracranial systolic CSF pressure. This concept is based on obstruction of CSF flow and repeated pulsatile mechanical distension of the spinal cord. The latter results in the accumulation of extracellular fluid because of the high pressure in the spinal cord microcirculation. Edema in the less resistant dorsal funiculi would precede the development of the syrinx. Patients often develop the syrinx initially associated with the spinal cord segment just caudal to the C2, C3 intervertebral disc or in the segment located within the vertebral foramen of C2 as the disease progresses and the syrinx enlarges. The C1 spinal cord segment appears to be spared in most patients with regard to the formation of the syrinx. The exact reason for this is not clear. One possibility may be explained by the Venturi effect. An apparent narrowing of the vertebral canal is associated with the C2, C3 intervertebral disc space in many of these patients. This results in an increased pressure and decreased velocity of CSF cranial and caudal to the intervertebral disc space and a decreased pressure and increased velocity at the site of the intervertebral disc. This would result in potential movement of CSF along the perpendicular spaces in the spinal cord because of the altered pressure from the Venturi effect. It is well recognized now that surgical enlargement of the foramen magnum results in spontaneous resolution of the syringohydromelia in many patients. Perhaps other patients will improve if the stenosis occurring at the C2, C3 intervertebral disc level is also addressed. Other lesions that cause excessive tissue mass in the brain, especially in the caudal cranial fossa, such as neoplasms and cysts, also cause the same interference with CSF flow dynamics in the same spinal cord lesions that resolve after surgical removal of the mass or enlargement of the foramen magnum. The occipital bone malformation is most common in the small breeds, especially the Cavalier King Charles Spaniel, in which EV, dense phylogenetic basis exists. 22 clinical signs vary in onset from a few months to the early adult years and most commonly relate to the cervical spinal cord. 23 The most common clinical sign is discomfort. Affected dogs may be hyperesthetic and act very sensitive to any touching of the head, neck, shoulder, or sternum. In addition, some dogs exhibit continual scratching anywhere from the ears to the thoracic limb-shoulder region. In some stressful situations such as a visit to the veterinary hospital, the animals would often scratch more. This may relate to the tendency for the cervical syrinx to dissect laterally from the dorsal funiculus into the adjacent dorsal gray column and interfere with its role in sensory functions. Scoliosis may also result from this dorsal gray column lesion, with the neck bending away from the side of the dorsal gray column lesion. Some dogs exhibit a lower motor neuron paresis in one thoracic limb if the syrinx involves the ventral gray column of the cervical intumescence on that side. Others, with involvement of the lateral funiculus, may develop an upper motor neuron paresis and general proprioceptive ataxia. Occasionally, cerebellar vestibular signs have been reported and may or may not be related to formation of syringobulbia. Facial paresis and deafness have also been reported, and rarely seizures may occur. The seizures probably relate to the alteration of pressure in the prosencephalic ventricular system. Once clinical signs are observed, they usually progress until surgery is performed to enlarge the foramen magnum. Diagnosis is made with MRI. Median plane T2 weighted MRI is most diagnostic of the herniation as well as the syringohydromelia. Figure 3-55. Veterinary surgeons have recognized that a thickening of the dura arachnoid dorsal to the compressed medulla and first cervical spinal cord segment is associated with this chronic herniation. This fibrotic tissue is removed in the decompression procedure without apparent clinical complications resulting from surgical manipulation of the cerebellum and first cervical spinal cord segment or CSF leakage into the adjacent tissues. In our experience, insertion of a titanium mesh may help protect against the formation of scar tissue at the surgical site. Calvarial ossification. There are two variations of the ossification of the calvaria that are often mistakenly related to neurologic disorders. They are seen primarily in the small breeds. One involves the occipital bone at the foramen magnum and the other the frontoparietal suture. A dorsal notch or extension of the foramen magnum has been referred to as occipital dysplasia and has been mistakenly related to clinical signs of congenital or acquired neurologic disease. This anomaly of the occipital bone occurs primarily in toy breeds or medium-sized brachycephalic breeds, and there are no conclusive data to support that it is related to any clinical neurologic signs. This keyhole foramen is common in the Cavalier King Charles Spaniel, with or without an associated occipital bone malformation and syringohydromelia. A doctoral study of a large number of clinically normal dogs showed a considerable variation in the shapes and sizes of the foramen magnum. 31 A dorsal notch of the foramen magnum was commonly present in the skulls of breeds of small-sized dogs. This space in the occipital bone, where no bone exists, was filled by a membrane of connective tissue. This dorsal notch was considered an area of incomplete ossification of the ventromedial aspect of the supraoccipital bone. It is a variation in the normal morphology of the occipital bone that is most common in the small brachycephalic breeds and is not related to any disturbances of the nervous system. Incomplete ossification at the frontoparietal suture is referred to as emolar or fontanelle. In many breeds, this is a normal feature at birth, and it rapidly closes in a few days to a few weeks. However, in the toy breeds, especially the Chihuahua, this molara may persist in the adult dogs. Unfortunately, some veterinarians have mistakenly related any persistent space here to a hydrocephalic condition in the brain, but this has no basis. The breed standard accepts the presence of a small molara in the adult Chihuahua. The size of the acceptable space is difficult to define, but it varies in shape and usually is in the range of 5 mm in diameter, about the size of the tip of the little finger. If hydrocephalus is suspected in a toy breed with a persistent molara, the diagnosis can be easily confirmed or ruled out by ultrasonographic evaluation of the lateral ventricles through the persistent molara. Spinal cord malformations. A number of important features must be emphasized with regard to spinal cord malformations. The clinical signs will be present at birth or when the newborn animal first tries to walk, and they will not progress. Spinal cord malformations are most common in calves and most commonly occur in the thoracolumbar segments. 3 vertebral column malformations often accompany the spinal cord malformations because of their close developmental relationship, and these vertebral malformations may be visible or palpable. Despite the many different forms of myelodysplasia that we have seen, no specific clinical sign distinguishes one malformative spinal cord lesion from another. A very common lesion is a duplication of the spinal cord, with both components contained in one set of meninges, one dural sheath. This is called diplomyelia. Figures 3-56 and 3-57. Less commonly, 2 spinal cords are present, each with its own meningeal sheath and each in its own vertebral canal, separated by a bony partition. This malformation is called a diastematomyelia. Figures 3-58 and 3-59. In less successful attempts at duplication, a mass of excessive gray matter may be present at the spinal cord, with no demarcation into the respective columns, or attempts at duplication of a dorsal or ventral gray column may be evident. The central canal is often absent or it may be dilated, which is known as hydromyelia. Cavities are commonly seen in the white matter and occasionally in the gray matter. This lesion is called syringomyelia. The ventral median fissure may be absent, and neuronal cell bodies may be spread across the midline between the ventral gray columns. If a few spinal cord segments are smaller than normal, it is known as segmental hypoplasia. Sometimes these small segments contain only white matter tracts and no gray matter. No studies have been done on the inheritance of these bovine malformations. Regardless of the nature of the thoracolumbar spinal cord malformation, if the animal is able to walk, it is common for the pelvic limbs to be used simultaneously in a bunny hopping fashion. Video 3-2 shows a 1-week-old Holstein that is able to walk unassisted in spite of a mild lumbar scoliosis and associated myelodysplasia. Figures 3-60 and 3-61. Video 3-3 shows a 2-week-old Holstein that has been unable to stand since birth. Note the bunny hopping movements when it is assisted to stand in the mild palpable lumbar, L2, L3, vertebral abnormality. A CT showed both the mild vertebral malformation and segmental hypoplasia of the spinal cord. At necropsy, a widespread thoracolumbar myelodysplasia and a sacral segment diplomyelia were observed. No specific gross or microscopic malformative lesion relates to bunny hopping, which is a unique clinical sign. We assume that the disorder occurs in the central pattern generator network of the pelvic limb within the lumbosacral intumescence that is responsible for inhibitory inter-neuronal connections between the ventral gray columns that are involved in the gait. Normally, the initial flexor muscle activation at the onset of protraction in one limb is accompanied by extension in the opposite limb and inhibition of the flexors of that opposite limb. A submicroscopic alteration in these commissural interneurons may be the basis for the simultaneous bilateral flexor responses at the onset of protraction and when both limbs respond when the flexor reflex is stimulated in one limb. This bilateral response is not seen with the patellar reflex, which is a monosynaptic tendon reflex that does not involve interneuronal connections with the opposite side. We can confidently state that this bunny hopping gait does not involve spinal cord tracts that project cranially or caudally in the spinal cord because we have seen it in a recumbent newborn segmental calf with no cranial lumbar segments. Indicate, in an L1 to L3 segmental aplasia. Figures 3-62 and 3-63. The isolated segments of the lumbosacral intumescence were entirely responsible for very brisk simultaneous bilateral pelvic limb protraction movements with any stimulus to the limbs. Video 3-4 shows this 3-day-old segmental calf. Note that this simultaneous pelvic limb protraction occurs whether the calf is recumbent or is supported by the tail in a position that allows walking. As soon as the hooves touch the floor, a brisk bilateral hip flexion occurs to advance the limbs. This is a clear example of the spinal reflex walking present at birth and is a classic example of complete loss of the normal role of the upper motor neuron in the inhibition of extensor motor neurons. The pelvic limbs in this calf were in a constant state of hypertonicity because of an isolated intumescence that had no connections with any other part of the CNS. The rapid bilateral flexor reflexes that respond to any noxious stimulus should not cause any confusion and led to thinking that the calf is trying to avoid a stimulus. This calf is completely analgesic in the pelvic limbs and the pelvic and perineal areas. Spina bifida, meningomyelocele. Spina bifida and meningomyelocele are two distinct malformations that are often confused. Spina bifida refers to the failure of the closure of the dorsal aspect of the vertebral foramen of one or a few vertebrae. If many adjacent vertebrae are involved, it is called rachis. These are caused by failure of the vertebral arches to develop. They are often associated with neural tube malformations and include a meningocele or meningomyelocele with spina bifida and myeloschisis with rachis. A meningocele is a protrussion of meninges and an accumulation of CSF outside the vertebral canal beneath the skin and therefore requires the presence of spina bifida. A meningomyelocele is a protrusion of the meninges and associated nervous tissue outside the vertebral canal. Usually, the nervous tissue involved consists of spinal nerves and rarely of spinal cord segments. Myeloschisis is, by definition, failure of the neural tube to close and usually involves a number of adjacent spinal cord segments. For this to occur, the skin ectoderm remains attached to the borders of the neural plate, which prevents any vertebral arches from forming and results in a rachis. Figure 3-64. Prior to birth, this open neural tube is exposed to amniotic fluid, but after birth, it is exposed to environmental air and rapidly undergoes desiccation, which is often associated with hemorrhage along the surface of the neural plate. A sacrocaudal spina bifida and meningomyelocele are most common in the Manx breed of cat and in English bulldogs. 14. The Manx cat is known for the absence of its tail, which, in fact, is the trait that is selectively bred for by Manx owners. The caudal vertebral hypoplasia or aplasia is inherited as an autosomal dominant gene. In the homozygous state, this is a lethal factor. The clinically affected cats are heterozygotes with variable expression. This is unfortunate because in breeding for one malformation, that is, the lack of a tail, breeders of these Manx cats are causing other associated malformations, especially in the adjacent vertebrae and the spinal cord. The various forms of spinal cord malformation, myelodysplasias, may result in excretory dysfunctions such as urinary and fecal incontinence that is sometimes associated with loss of tone, reflexes, and nociception in the anal and perineal area. In more severe myelodysplasias that involve the sacral and caudal lumbar spinal cord segments, partial or complete interference with the ability to stand and walk with the pelvic limbs may occur. Figures 3-65 and 3-66. Owners recognize the severity of these cases shortly after the birth of the kittens and euthanize them. This prevents the profession from understanding how widespread this malformation is in the breed. Affected cats that are able to stand and walk often use their pelvic limbs simultaneously in a bunny hopping fashion, which is a common clinical sign of myelodysplasia in any species. If these cats with urinary and fecal incontinence are kept by well-meaning breeders or owners, the cats may eventually develop urinary tract infections that led to pyelonephritis. Most affected cats are euthanized between 4 and 8 months of age. Breeders should be urged to stop breeding for absence of tails, and the veterinary profession should be proactive in providing this advice. The epitome of success in breeding for multiple system malformations in this breed was observed in an incontinent Manx cat that had a cloaca. In addition to the complete absence of the tail in the last two sacral vertebrae, only one external orifice was present in the perineum, serving for excretion of both feces and urine. Cloacas belong in birds, not cats. If the diagnosis is not clear, myelography or MRI will show the continuation of the subarachnoid space through the spina bifida into the subcutaneous area. Video 3-5 shows a 6-month-old female Manx cat that was presented for incontinence and exhibited a bunny hopping gait. Also, note the simultaneous flexion of both pelvic limbs when only one pelvic limb receives a noxious stimulus. Sporadic cases of spina bifida and meningomyelocele are recognized in patients. Recently, e.g., studied a young unilaterally cryptorchid male German Shepherd dog with an unhealing wound over its sacral region, urinary incontinence, and a deviated tail. The gait was normal except for equivocal short strides in the pelvic limbs. MRI revealed spina bifida and meningomyelocele continuous with the wound on the skin surface at the sacrocaudal articulation. Figure 3-67. At surgery, the open meningeal defect was closed, the spinal nerves that abnormally extended to the skin surface were severed, and the skin defect was closed. Recovery was satisfactory. In dogs, the most familiar and well-studied spinal cord malformation is spinal dysraphism, which is inherited in the Weimaraner breed. McGraw studied a colony of these dogs at the University of Pennsylvania and published his results in 1965. 16-18 Spinal dysraphism is defined as an incomplete closure of a raphe or defective fusion of the neural tube, which is not what happens in these dogs. In the 1956 edition of his textbook, McGraw described this as syringomyelia in Weimaraners because of the cavities that he had observed in the dorsal funiculi. 15 In 1965, after further study, he described the primary malformative lesion to be microscopic and involving primarily midline structures, aberrations of the dorsal median septum, the absence of a ventral median fissure, hydromyelia or an absent central canal, and the presence of ventral gray column neuronal cell bodies scattered across the midline in the ventral funiculi as a result of their failure to migrate into the ventral gray columns. 17 These lesions occur in scattered thoracolumbar segments. In a few dogs, it may be difficult to find any microscopic lesions at all. No term is specific for these microscopic lesions, and we think that it is more accurate to refer to this as inherited myelodysplasia of Weimaraners. Some of these Weimaraners have other malformations, including scoliosis, abnormal hair patterns on the dorsal aspect of the neck, and a depression of the sternum known as coilosternia. The clinical signs are first observed as these dogs begin to walk, when they consistently exhibit a simultaneous gait with the pelvic limbs. A variable degree of paresis and ataxia may be present in some dogs that may limit their ability to be satisfactory pets. Video 3-6 shows 2 5-month-old Weimaraners that had this gait since birth. The clinical signs observed will not change with time. Many bunny-hopping Weimaraners have found homes and have made delightful pets. These affected dogs and their parents should not be bred because this disorder is thought to be inherited as a codominant lethal gene, where the homozygous condition is lethal and the clinically affected dogs are heterozygotes. A gene mutation has now been identified in these affected Weimaraners. This mutation involves the gene NKX2-8, which is on chromosome 8. This is part of a group of genes known to cause developmental defects. It is important to remember that if an adult Weimaraner has bunny hopped since it was a pup and now has progressing spinal cord signs, it has a different disease. IAD have studied 1 litter of 6 Weimaraners in which 3 of the dogs showed the bunny hopping gait in all 4 limbs. Necropsy of one of these pups showed no gross or microscopic nervous system abnormality. Myelodysplasias are occasionally seen in breeds other than Weimaraners and in mixed breeds. IAD have studied 3 mixed-breed husky dogs from a litter of 9 that had been exhibiting the bunny-hopping gait in the pelvic limb since they were pups but had no other gait abnormality. 2 others in the litter had undefined malformations of their appendicular skeleton. Video 3-7 shows 2 1-year-old Chow Chow ex-shepherd mixed-breed dogs that were donated to Cornell University because since birth they had showed simultaneous use of both pelvic and thoracic limbs. Amazingly, they were normal in all other respects and made outstanding pets for the 2 veterinary students who adopted them. Pathogenesis of malformations. The above examples show the variety of factors that could lead to abnormal development of the nervous system. Knowing the correct cause helps prevent the birth of further malformed animals. Because inherited gene abnormalities are so common, breeders often jump to this conclusion, without any scientific basis. It is most important first to have a confirmation of the morphology of the malformation. This usually requires a necropsy diagnosis. If the disorder is inherited, a confirmed diagnosis is required before any judgments can be made about the parents of the affected offspring. Published data support the inherited basis of malformations. When such data are lacking, breeders must carefully document all the confirmed cases of the disorder and determine from pedigree studies whether the disorder fits a pattern of inheritance. Planned repeat breedings may be necessary to establish inheritance, but that is expensive and time-consuming and will result in producing more affected animals. With remarkable rapid progress being made in the study of the gene codes of the various species of domestic animals, abnormalities are being understood at the gene level, and this has led to the development of blood tests that can identify affected and carrier animals. Dedicated use of these genetic tests provides the opportunity to significantly decrease the incidence of many of these malformations and even eliminate them. Consider the following case example of a Hereford calf brought into the necropsy service at the College of Veterinary Medicine at Cornell University from a small Hereford farm in upstate New York.